Hi, I am not the best at making videos. I only do them if I have to, so bear with me as I hope won't be too boring since I'm not used to making videos. Um, Anyways, so for this assignment, we are given this scenario. The emergency medical services team has brought a 54-year-old female patient to the emergency department where you are working. The EMS personnel state that the patient was found wandering in a nearby park by a jogger, who then called 911 from her cell phone after the woman screamed obscenities at her and then fell, scraping her arm and face. The woman is bleeding, disoriented, combative, and accusing the EMS team of stealing her purse. Her hands are shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. The woman's clothing is dirty, and you could smell stale body odor and urine. And there are some questions to follow. So, based on your first impression of this patient's actions and appearance, what do you suspect she is suffering from? So, I thought either dementia or Alzheimer's. So I suspected the patient is suffering from dementia. Although there are several forms of dementia, I came to this guess because dementia, according to the Mayo Clinic website, dementia exhibits behaviors such as memory loss, difficulty communicating or finding words, difficulty reasoning or problem solving, difficulty handling complex tasks, difficulty with coordination and motor functions, confusion and disorientation, personality changes, depression, anxiety, inappropriate behavior, paranoia, agitation, hallucinations. So that is a lot of symptoms here. But in the scenario, looking back, there's disoriented, combative, accusing of stealing her purse. So that's how I came to the conclusion that I think that this woman is suffering from dementia. Many of these cognitive and psychological changes were exhibited in this scenario. Dementia is the loss of cognitive functioning, like thinking, remembering, and reasoning, and behavioral abilities, such as extent that it interferes with person's daily life and activities. These functions include the memory, language skills, visual perception, problem solving, self-management, and the ability to focus to pay attention. Some people with dementia cannot control their emotions, and their personalities may change. Dementia ranges in severity from the mildest stage, when it's just beginning to affect a person's functioning, to the more severe stage, when the person must depend completely on others for basic activities of living. Signs and symptoms of dementia result when once healthy neurons, the nerve cells, in the brain stop working, losing connection with other brain cells, and die. While everyone loses some neurons as they age, people with dementia experience far greater loss. The causes of dementia can vary depending on the types of brain changes that may be taking place. This leads to different types of dementia, which there are several types of dementia, Alzheimer's being the most popular. So this next question is, what short and long-term health risks would you suspect this patient faces? So there is quite a bit of things that I thought of and also researched. So getting lost on familiar routes, forgetting events in your own life history, losing awareness of who you are, change in sleep patterns, often waking up at night, poor judgment and loss of ability to recognize danger, hallucinations, arguments, striking out, and violent behavior, delusions, depression, agitation, difficulty doing basic tasks such as preparing meals, choosing proper clothing, and driving, difficulty swallowing both foods and liquids, incontinence, which in the scenario, the lady smelt of urine, so she had some incontinence going on, loss of ability to function or care for self, falls and broken bones, loss of ability to interact with others, malnutrition and dehydration failure of body systems, bed sores, muscle contractures, infections like UTI and pneumonia. People with dementia will eventually need to be cared for by family or professional caregivers, as it will be too dangerous for them to live on their own. I mean, all that list of things I just listed can be so dangerous for someone with dementia to live on their own. So, next question. Why do you think the patient's hands are shaking, and what do you think causes her confusion and combativeness? So, upon researching dementia, I came across that, there are many types, and I came across a type that might fit with why this patient shakes. There is a type of dementia called Lewy body dementia. This dementia has all the same characteristics in the scenario, but it includes shaking. It has Parkinson-like movements. Lewy body dementia is progressive. Signs and symptoms worsen, causing severe dementia, aggressive behavior, depression, increased risk of fall and injury, worsening of Parkinson's signs and symptoms such as tremors and shaking. And this is all according to the National Institute of Aging. Okay, so last question. What assessments do you think are needed for this patient? There is a lengthy list of things that are used to diagnose dementia. Doctors first assess whether a person having an underlying treatable condition such as abnormal thyroid function, normal pressure, hydrocephalus, or vitamin deficiency that may relate to cognitive difficulties. Early detection of symptoms is important. Some causes can be treated. So some things that can be looked for is medical history. Typical questions about a person's medical and family history might include asking about whether dementia runs in the family, physical exams, measuring blood pressure, and other vital signs may help physicians detect conditions that might cause or occur while with dementia. Neurological tests like assessing balance, sensory response, reflexes, and other cognitive functions help identify conditions that may affect the diagnosis or are treatable with drugs. Also used to diagnose dementia, cognitive and neuropsychological tests to assess memory, problem solving, language skills, math skills, and other abilities related to mental functioning. Laboratory tests, testing a person's blood and other fluids, checking levels for various chemicals, hormones, vitamins, those can rule out some things. Brain scans, they can identify strokes, tremors, and other problems that cause dementia. Psychiatric evaluations, genetic tests. Mental illness management includes both this is the last question. Mental illnesses management includes both pharmacological and other therapeutic methods for treatment. Summarize how this is managed and the support of insurance. Is it significant? What could make it better? So I didn't relatively find anything insurance-wise, but I did find the therapeutic and pharmacological methods. Some was in her book and some was at the Mayo Clinic website. Most types of dementia can't be cured, but there are ways to manage symptoms. Medications will only temporarily improve dementia symptoms, according to our book referenced in the bottom of this video. I will put it there. Which also lists some medications, our pharmacology book. So therapies are helpful. Several dementia symptoms and behavior problems might be treated initially using non-drug approaches, such as OT, occupational therapy. This can show you how to make your home safer and teach coping behaviors. The purpose is to prevent accidents such as falls, managing behavior, and prepare you for dementia progression. That is obviously the caregiver or whoever will be taking care of the individual with dementia. Also, modifying the environment, reducing clutter and noise that can make it easier for someone with dementia to focus and function. You might need to hide objects that can threaten safety, such as knives and car keys. Monitoring systems can alert you if the person with dementia wanders. Simplifying tasks, break tasks into easier steps and focus on success, not failure. Structures and routines also help reduce confusion in people with dementia. So a lot of these things remind me of just, like a little kid, like just what you do, like with a toddler. Let's see. So a lot of these things are obviously for the caregiver because the person with dementia will not be able to fulfill these things. There are also lifestyle and home remedies. Dementia symptoms and behavior problems will progress over time. Caregivers might try some things out like enhanced communication when talking, maintain eye contact, speak slowly, simple sentences, don't rush the response, present one idea or an instruction at a time, use gestures and cues such as pointing at objects. Again, kind of like I feel like you're, talking to a toddler. Encourage exercise. There's benefits, include improving strength, balance, cardiovascular health. Engage in activities, plan activities that the person with dementia enjoys, like dancing, painting, gardening, cooking, singing. It'll help connect with them. Establish a nighttime ritual. Behavior is often worse at night. Try to establish good bedtime rituals that are calming in a way that from noise or television. Meal cleanup and active family members. Leave night lights on in the bedroom to prevent disorientation. Limit caffeine. Discourage napping. Keep a calendar. A calendar will help your loved one remember upcoming events, daily activities, plan for the future. Develop a plan with your loved one while he or she is able to participate that identifies goals for future care. So a lot of that is not really insurance related, but it is good therapeutic methods. There's only some medicines that were the pharmacological. Most of it was therapeutic methods that I found. And then, so yeah, at the bottom of this video, I will put my references. So thanks for watching this video. Hopefully it wasn't too much of a bore. I don't make a lot of videos, like I said, and I find myself stumbling, still stumbling on my words. So hopefully wasn't too much of a drag. All right, thank you.